My pain is real.
I'm not alone.
I didn't know I could change pain.
I'm worth working on.
There's so much I can do to change my pain.
I didn't know I could change pain.
I'm worth working on.
My pain is real.
I'm not alone.
I'm not alone.
How to support women with chronic pelvic pain. If you have a friend, family member, or partner with chronic pelvic pain, you may wonder how to best support them.
The first step is to learn about chronic pelvic pain. Chronic pelvic pain affects at least 20% of women of reproductive age, although the numbers are most likely higher.
Pain is always real. Pain is different from tissue damage or disease. You can't see pain on tests or investigations, but it's always real.
Chronic pain can be very distressing, but we know that it, along with the quality of life and function, can be improved by following a treatment plan, including a prescribed self-management plan.
The second step is to understand that treatment plan. When your friend or family member comes to our clinic, she will undergo a full assessment with our specially trained gynecologists. Gynecological treatment may include medications or surgery.
For women with factors in addition to gynecological, such as musculoskeletal, psychosocial, or a sensitive nervous system, our gynecologist may recommend that she attend our interdisciplinary program. This includes a pain education workshop and appointments with our counselor and physiotherapist.
A self-management plan will be developed and will include
physiotherapy exercises,
pacing and grading of activity,
mindfulness-based strategies,
cognitive-based strategies such as compassionate self-talk,
and self-care.
Now that you know what we can do to help, you may also want to know how you can help. What you can do.
Listen and believe.
It can be hard for anyone to fully understand someone else's pain.
What's important is that you listen to her and believe her.
Most of us want to support others, but we just don't know how.
We encourage you to have a discussion as to what would be most helpful for her, as everyone's needs are different.
Every woman in our workshop is given a How to Support Me worksheet that you can both look at together and complete together.
Encourage her to practice the recommended self-management tools and be aware that this will require her to take some time out of her day.
Research shows that our recommendations can be very effective in changing pain, but often women have difficulty prioritizing time for themselves.
Helping her to make them a priority is very important.
Some of the strategies include a mindfulness practice such as meditation.
Another strategy is using compassionate, balanced self-talk.
We've encouraged your loved one to avoid pushing through pain into flare-up when trying to complete tasks, exercise, or other daily activities.
Pacing means she will be taking breaks before she needs them, and we will encourage her to do less on her good days rather than packing them full of tasks and activity. She will be working on gradually increasing function over time.
Flare-ups can also happen when stressful events occur or when the self-management plan has been stopped. By avoiding the flare-up pattern, women can start to improve function gradually with less pain overall.
Interestingly, communication can affect pain.
Pay attention to conversations you have with your loved one.
Do they all revolve around pain, or do they avoid pain altogether?
It's important to have a balance. Acknowledging pain is important, but don't let pain take over all conversations.
Also, asking your loved one if she is okay or if she is in pain can actually increase her attention to pain.
Instead, ask what she needs. That may be a more helpful way of showing support without reinforcing attention to pain. Supporting or living with someone with chronic pelvic pain is not always easy.
It's important for you to practice self-care and to access support as well.
Finally, let's recap the important points.
Listen,
Believe, offer support,
encourage the practice of self-management tools,
support pacing,
and engage in balanced communication.
We hope this has been helpful for you.
And we wish you
and your loved one all the best.
When I started pacing my household tasks, my partner used to finish the jobs I had started to help me out. I explained to them that I wanted to be able to finish the tasks myself, that it would take longer, and I was okay with that. Now I can complete my tasks on my own with support from my partner, which feels really good.
When my partner kept asking me if I was in pain or if I was okay, I knew they were trying to help, but it actually made me pay even more attention to my pain. When we agreed that I would let them know if I needed something, it really helped me focus less on my pain.
www.bcwomens.ca and search for pelvic pain and endometriosis.